This audio lecture is going to explore muscular strength and endurance, field tests and laboratory tests with that, as well as overall fitness test batteries. When measuring muscular strength and endurance, it's important for us to differentiate between the differences of work and power. Some of you may have already discussed these things in previous courses like biomechanics or physics, but the definition of work is the result of the physical effort that is performed. The equation for work, or W, equals force times distance. Power is the amount of work performed in a fixed amount of time. Power equals force times distance divided by time, or it can be simplified as power equals work divided by time. When we're talking about muscular strength is the force that can be generated by contracting muscles, and torque is the effectiveness of a force for producing rotation around an axis. Let's practice those calculations. We want to calculate work and power. We have 150 pounds, 2 feet, 5 seconds. So the equation for work is work equals force times distance, or our force is 150 pounds, our distance is 2 feet. So 150 pounds times 2 feet gives us 300. That's our work. Now, when it comes to power, we know that power equals force times distance over time, or equals work divided by time. If we know that our power equals our work, which is 300 pounds per foot, over our time, which is 5 seconds, we get a power of 60. Next, we're going to talk about muscular endurance. Muscular endurance is the physical ability to perform work. Can you think of an example of a field test that can test muscular endurance? One example we've used previously is the pull-up test. For that, the maximum number of pull-ups is performed, which is a measure of the amount of work completed. When talking about muscular endurance, we have both relative endurance and absolute endurance. Relative endurance is the measurement of a repetitive performance related to maximum strength. Relative endurance is when benching, perform as many reps as possible at 75% of maximum strength. Absolute endurance is the measurement of repetitive performance at a fixed resistance. So an example of absolute endurance would be performing the maximum number of reps at 100 pounds. When looking at muscular strength and endurance, absolute endurance is highly correlated with maximum strength. Relative endurance has a low correlation to maximum strength. Like many of our other assessments, for measuring muscular strength and endurance, we have both laboratory methods and field methods. Some examples of laboratory methods are measuring force, torque, work, and power generated through concentric, eccentric, isokinetic, and isometric contractions. We also have some field methods, which are assessed with concentric and isotonic contractions. Related to repetition maximum, we want to indicate how many repetitions one can do. There are different types of contractions that can be measured. The first is the concentric. This is how muscles generate force as it shortens. We also have eccentric strength, or eccentric contractions, and this is muscle generates force as it lengthens. Isometric is when a muscle generates force but remains static in length and causes no movement. Isotonic is when muscles generate enough force to move a constant load at a variable speed through a full range of motion. And then isokinetic, muscle generates force at a constant speed through full range of motion. On the PowerPoint, there is a link to a video that further breaks this down that I would highly encourage you watch. With our laboratory methods, we have several options. The first is a computerized dynamometer, or a biodex. Computerized dynamometers integrate mechanical ergometers, electronic sensors, computers, and software to provide detailed measurements of force, work, torque, and power. These can be maximal values, but also through a range of motion. Strength is usually measured in terms of peak force, and endurance is usually measured in fatigue rates and force production. What this means is the software is able to output a peak force for strength, so the highest amount of force that can be generated. Whereas on the endurance side, you might do the same movement multiple times, and it's measured once the fatigue rates and the force production appear. Some additional laboratory methods are non-computerized dynamometers or handheld dynamometers. Handheld dynamometers can provide an objective measure of isometric strength. They're portable and less expensive and can be used in more diverse settings and for various muscles. Unlike the biodex is usually fixed to specific joints. And then we also have manual muscle testing. This is most often used in clinical situations to assess muscle strength. When using a handheld dynamometer, or an HHD, the tester instructs the patient to perform a desired motion. The tester holds the handheld dynamometer in one hand and stabilizes with the other. The patient pushes or pulls against the device with as much force as they can. The handheld dynamometer will display the maximum force. One of the disadvantages to this method is the tester needs to be strong enough for the force that is applied from the patient. You can also apply a handheld dynamometer with a strap, and the results can be reliable and valid, but can differ between brands. In the PowerPoint, there is also a link to a video that I would encourage you watching that breaks this down a little bit more. Clinicians often use manual muscle testing to measure strength. No equipment is required for this, and manual muscle testing is rated on a 5-point scale, and some scales also use pluses and minuses. For manual muscle testing, the clinician applies resistance to a patient for a specific movement. For example, if we were to test the bicep, the patient being able to do a bicep curl against gravity would score them a 3 out of 5, and then we would provide resistance from there. So after they can do it against gravity, the clinician would apply moderate resistance as they go through that bicep curl muscle. If they can do that, that would be a 4. And then a 5 would be with significant resistance. Again, the video in the PowerPoint further breaks this down, and I highly encourage you to watch it. This is an example of a manual muscle testing grading scale. The most common grading scale is the one in the middle, the 0 to 5 scale, with pluses and minuses. And you can see there a 3 holds the testing position with no added pressure, and then holds it against strong pressure is a 5. If we're going below a 3, a 2 moves through the partial range of motion is a 2+. A 2 is moving through a partial range of motion in an anti-gravity position. And then a 1 is that there is a contraction, and a 0 is no contraction is felt. Some field methods to measure strength and endurance are lifting external weights or body weight. We can assess maximum strength by measuring 1 RMs or 1 repetition maximums. And for muscular endurance, it can be measured with maximum number of repetitions of a weightlifting exercise with a submaximal weight load, or a body movement exercise such as sit-ups can also assess muscular endurance. Some specific field method tests that can assess strength and endurance include the 1 RM values of the bench press and the leg press strength tests, the YMCA bench press test, the Canadian Standardized Test of Fitness, the YMCA half sit-up test, and the curl-up test. Here are our breakdowns of age and fitness level for both the bench press strength rating and the leg press strength rating. You can divide the 1 RM values by body weight to present a strength measure that is equitable across weight classes. The next few slides are the different protocols for various strength and endurance tests, along with the norms associated with them. I have included these for your reference in case you don't have the textbook and want to be able to refer to these in the future. So this is the YMCA bench press test. The Canadian Standardized Test of Fitness is a push-up test. And as you can see here, there's a traditional and a modified variable. And we also have the YMCA half sit-up test. Body weight is negatively correlated with the results of this test. In our previous lectures, we had talked about how bone density is one of the components of health-related fitness. Bone density is a good indicator of bone health. A bone density test, also known as bone densometry, is used to measure bone mineral content and density. There are laboratory methods for this, including X-rays, DEXA, or CT scans. Some field tests that aren't as great as our laboratory tests include diagnostic ultrasounds, trunk extension, and jump and strength tests. When we're looking at a DEXA scan, which assesses bone mineral density, we want to compare it to various norms. We have T-score norms for healthy young adults, and we also can compare it with Z-scores for an aged matched adult. If you remember, Z-scores are the way we convert some of our data so that the mean score is 0 and each standard deviation is 1. Bone mineral density reaches its peak between 25 to 35 years of age. So the T-score is compared to the bone mineral density of a healthy 25 to 35-year-old of the same sex and ethnicity. A positive T-score indicates the bone is stronger than normal. A negative T-score indicates that the bone is weaker than normal. When we're looking at bone mineral density, a T-score of -1 or above indicates a normal bone mineral density. If you recall, the normal distribution for T-scores, the mean is 50 and each standard deviation is 10. So just keep that in mind. A T-score between -1 and -2.5 indicates low bone mass, and a T-score less than -2.5 indicates the presence of osteoporosis. The risk of bone fracture doubles with every standard deviation below normal, or below that -1, which can be depicted here on this figure. When we're looking at the z-scores, we're measuring that compared to an age matched norm. So the z-score is the same as in previous chapters, again, a mean of 0 and a standard deviation of 1. You want to compare to an age, sex, race, height, and weight matched norm. So there is a lot of normative data in the DEXA system so that all of these things can be taken into effect. A person with a z-score of 1 indicates their bone mineral density is 1 standard deviation above the mean bone mineral density for their matched peers. That doesn't mean it's equivalent to that of peak bone mineral density like it does for the t-scores. When we're examining children under 20, only z-scores should be used because, again, peak bone mineral density occurs usually between 25 to 30. So we can't use those t-score norms because they would not have achieved that level of bone mineral density yet. While we've already talked about some specific tests for measuring strength and endurance, there are some health-related fitness test batteries. These are a combination of different tests that are standardized together to create a more comprehensive picture. Some of the most common are the YMCA Physical Fitness Test Battery, the Canadian Standardized Test of Fitness, the President's Challenge Adult Fitness Test. However, it is important to note that this fitness test is being reviewed and is unavailable in its completed form to the general public at this time. There are a lot of benefits to health-related fitness batteries. One, they provide a large range of data and are usually pretty easy to administer. These are often used by the YMCA to assess physical fitness of its members. They're easily adaptable to many adult physical fitness testing situations. Within the YMCA Physical Test Battery, it requires you to collect data on height, weight, resting heart rate, resting blood pressure, body composition in the form of skin fold at the site's abdomen, superilium, triceps, and thigh. It requires a cardiovascular evaluation utilizing a 3-minute step test. Flexibility is evaluated using the sit and reach. Muscular strength is evaluated using a bench press test, and muscular endurance using a half sit-up test. The next few slides will present the norms and methodology for the remainder of the tests for the YMCA battery that haven't already been presented in this unit. So here we have the equation for estimation of percent body fat and the procedure for the YMCA skin fold test. This is the procedure and the norms for the YMCA 3-minute step test and the procedure and norms for the YMCA trunk flexion sit and reach test. The last test battery we're going to talk about today is the Canadian Standardized Test of Fitness. This resulted from a Canadian fitness survey that was conducted in 1981 to understand the fitness level of the Canadian population. And the Canadian Standardized Test of Fitness requires you to collect data on the resting heart rate, resting blood pressure, body composition in the form of skin folds, cardiorespiratory endurance. There are multiple options on how to evaluate that. Flexibility, they use sit and reach. Abdominal endurance, they use the 1-minute sit-up test. And upper body strength and endurance, they use a push-up test. You can find online the various norms for the Canadian Standardized Test of Fitness. The following are some review questions to look over prior to your quiz.